Hi, everyone. Prep time is over. Can I please check if the proposition team is here? Please turn on your videos to indicate so.
Here.
Great. And team opposition?
We're here.
Awesome. So we'll do a round of introductions for each team first. Proposition, could you please introduce yourselves from the first to the third speaker?
So I'm the first speaker, I think that's now. And the second speaker will be Serafim Betrani, and the third speaker will be Giovanni Dimas, and the reply speaker will be Serafim.
Thank you, proposition. For the opposition?
I'm the first speaker of opposition. My name is Gania Akila Rafa. My second speaker is Keisha Divana, and my third speaker is Aldo Fernando, and reply will be done by me as well.
Awesome. Okay, thank you for that. We will do judge introductions now. So first of all, congratulations for making it to the quarterfinals. There will be 5 judges for this room. Myself, I am Judah. I will be judging for you this round. I am joined by a stellar panel of judges. We can start with introductions in alphabetical order. So from Batara.
Hi, I'm Batara from Sulsel. Good luck for everyone. Looking forward to judging this round.
Hi everyone, my name is Jessica. Good luck for this round. I don't have any gender preferred pronoun.
Hello everyone, I'm Feliani. I'll be paneling as well in this round. Good luck for the quarter-final round.
Hi everyone, I'm Johan. I'm going to be a panel in this round. Best of luck to all teams. No preferred pronouns as well.
Great. Okay, so I think everyone who's supposed to be here is here. Just 2 points of order. The first is I will be timing all of you and I will be sending timestamps through the chat. It is preferable though that you just time yourselves so that you can keep track of your own time every second. And secondly as well, please remember to state your POI preference before you start your speech. All right, with all that said, we can go ahead with the quarterfinal of NSDC. I welcome the Prime Minister. Here.
Right. Hi, am I audible?
Yes, you are.
All right. Gender pronouns are he or him. PI preference for you to unmute your mic. Okay. Starting my speech in 3, 2, 1. The fact that insulin shots for a diabetic person costs $200 because of patent right means that pharmaceutical products in South School are used as a commodity towards a small percentage of communities that can actually have access to it, which are the 1%, which are the higher class, right? Within developing countries, we need a much more accessible alternative, which is by removing this patent right and make sure that companies in that country can actually produce better and more accessible products for the people on the ground. Our stance is to disallow pharmaceutical products to hold patents from distributed in developing countries. 2 points of model in my speech. Firstly, how all pharmaceutical companies in developing countries are going to be free from patent right? This looks like, for example, how small pharmaceutical companies are able to freely produce some products that formerly had patent right, for example, like vaccines and medicines towards like certain illnesses, for example. Second point on model, how we think that there will always be regulations that exist, right? This looks like, for example, supervisions or production from the government or policies that you need like proper production method or according to a protocol, right? This is like BPOM that exists at school, right? This is feasible because we said that the state, even if they're developing country, even if they're developing anyways, already has the capital to supervise means of production. It doesn't take a lot of money to give up policies anyways, right? So opposition side doesn't have to worry about the quality of the product being diminished or etc. because we know this protocol is still going to be followed. 2 arguments I'm going to bring. Firstly, on why holding patent rights is unjustifiable for pharmaceutical products, and secondly, on why we bring better accessibility towards medicine. Before that, I'll take a POI.
The Badan POM and whatnot somehow are so costly until only some developing nation like Indonesia and whatnot who is lucky can have those things. How do you think about Afghanistan and maybe other like unlucky countries?
We think even if that is the case, we think government still has the kind of supervision and capability to actually do it. For example, they can always have policies that actually make sure that these kinds of pharmaceutical production is always going to be in play. You don't have to worry about that still, right? But two arguments then. First argument on why holding patent rights is justifiable in pharmaceutical products in developing countries. Let's just characterize first what the purpose of patent right actually is, right? We know the purpose of it is to give advantage to the creators of it to protect what they produce. This is also how, for example, it's like basically a copyright. It's basically a copyright where you want to protect your own work from being produced by other sorts of organizations. This is inherently made for people made for creators who are just starting their business, who actually want protection for their work to not be stolen by these other big companies, right? But why doesn't theirs have for this purpose? Within the primary needs like medicine and vaccines cannot be patented, especially when we're talking about a life and death scenario, for example, or how you actually need vaccines, or how you actually need vaccines in crises, or for example, medicine if someone's actually ill, right? To that extent, we think that it's more urgent for you to have a more accessible method in actually making central productions and not only be relied on this one singular company, on one singular body and entity that can only make one product at a time, right? But even if they actually need patent rights in the first place, we just characterize the ones that the patent rights. We just characterize the patent rights that actually are made by this, that are made for these pharmaceutical products, right? Within the patent rights are most likely going to be held by big pharmas and MNCs who are actually full of capital anyways. The problem is how they don't need the urgency for patent rights because they're already privileged in the first place to have this big capital for their own products. This is where patent rights doesn't fulfill their inherent purpose, which is to protect these kinds of creators anyways. But what's the implication, right? The ones that can only get these medicines are mostly going to be the ones in the capital city first, especially when we know the distribution of the vaccine or the medicines are going to be limited in opposition, where the company knows that the developing country isn't going to give you a huge and certain profit, right? Under the best case scenario of opposition is that the medicine is going to be cheap, meaning that these on the rural areas or their middle to low class are usually so vulnerable that they really need cheap medication that still have certainly good qualities, because we are able to make the same medication made by the company for the developed countries, right? But under opposition, the distribution will not be significant towards rural areas due to limited medication that is given towards developing countries under opposition, right? At least on our side of the house, we don't abuse these kinds of method rights in order to protect these kinds of MNCs or big pharmas, because we think they're already good anyways. Our side's to better on justification there. The second argument on why we bring better accessibility for medicine, right? The problem is even in government opposition's best case scenario, where big pharmas do have the incentive to actually give towards developing countries anyways with their patent rights, we still think it's going to be inaccessible anyways. Why is that likely? Because when you try to undercut production, there's going to be a limit rate on how these companies will actually produce, right? Because it's a risky move for companies like big pharmas to how they want to lower quality of products and have a lesser quantity, especially when we're talking about developing country who have less bargaining power anyways, right? It's a simple logic how if you want to better the product, it's going to be more expensive, and if you want it cheaper, it'll be worse. But why is it important, right? Two reasons. Firstly, how when they want to lower the price of the products, they're undercutting the production methods. The accessibility will be diminished even more because they can't get the right dosage of a medicine. For example, on how pills will going to be lesser, how vaccine dosages are going to be less or going to be less too. For example, the ones that are left that can take these medicines that have the right dosage are up for grabs are going to be a small percentage of the population inside the developing countries that can have access to these products. But moreover, we characterize to you these kinds of small percentages of people in developing countries are still hard. It's still difficult to garner these kinds of garner the right dosages anyways, right? Because within the developing countries, still even the higher class in developing countries still have less capital than those in developed countries, right? The second reason, exactly when the patent rights can only be produced by the creator or the products, developing countries are all on their own if they want to make an entirely new medicine, if they want to cater to it, if they want to cater to their citizens, right? This becomes harmful because it becomes nearly impossible for developing countries to actually could fulfill the time sensitivity when it comes to illnesses or or epidemics, for example, right? This because they don't have the accessibility to do so. It takes too much capital for you to invest in researching, testing, production. It takes so long method because you have to follow a strict protocol for you, right? But even if they can, it still takes a long time. The time sensitivity is still there, and their side cannot actually make entire new medicine at just like that, right? Comparatively, what do you get at the house? Two things. First, what will happen if you don't have patents towards these pharmaceutical products? The pharmacies in developing countries will be able to produce medicines with the same ingredients as the one made by big pharmas, right? This is where two benefits happen. Firstly, how accessibility happens because of market segmentation towards the people, right? How cheaper products for people that can't have access, but can happen because there will be companies who specialize in each product. This is exclusive because we don't rely on one single company that can that can have the only right to actually produce these kinds of that can only produce these kinds of medicines, right? But secondly, how competition can still happen. This is what creates innovation because how competition is how people are more incentivized to actually better their medicines and pharmaceutical products, so it can be the very best ever, right? This is where opposition still doesn't have to worry. So even in our worst case scenario where BPOM doesn't exist, it's still better because at least this kind of competition is where they're guaranteed to actually for example, have a better incentive to do better. There's no competition in theirs at the house because no one can have it. So this is where our set is exclusive and theirs is, right? The second layer, even in our worst case scenario where the quality of medicine is going to be bad, we say it's going to be temporary anyways, right? Ours at the house that these vulnerable people can actually have received adequate vaccines that are already approved by these pharmaceutical companies anyways, right? As bad as it is, it's still going to be effective. So proud to propose.
Thank you to the Prime Minister for that speech. Now I'd like to welcome the Leader of Opposition. Hear, hear.
Hi, am I audible?
Yes, you are.
Right, before I start, my pronouns are she, her. And if you have any POI, just feel free to open your microphone. Right. Starting my speech in 3, 2, 1. Panels on our side of the house, we know that meds are important for the sustainability in the life of individuals, but we believe that quality is the most defining factor in whether or not this aid or these medications can actually impact people for the better or actually hurt them for the worse. This is why on our side of the house, we oppose a proposition stance to disallow patents for medicines in developing countries. On opposition, we realize that this is very harmful and can harm lots of actors that are all really disadvantaged in the status quo. What do we want to prove as the opposition? First of all, we better protect vulnerable actors like civilians, and two, the importance of patents for better health advancements at the end of the day. Before I begin, I'd like to deliver one clarification and one rebuttal. I'd like to clarify that before I begin, we believe that medicine in terms of like vaccines and urgent medicines are going to be accounted for under this debate. But for smaller medicines like cough medications, we believe that in status quo, these are abundant, so there's little to no urgency to subsidize, and there's also like plenty of other methods for medication in depending to each country. Okay, moving on to my rebuttal. I want to rebut the proposition's claim on that they have the capacity to supervise with policies. To that we say that even in countries like Indonesia with the BPOM, there is a likelihood of misproduced control. Why? Because BPOM is obviously not at the level of producing penicillin yet. It's obviously not at the level of giving high quality medications that require high levels of production and supervision. And even when they want to say that in some cases this is true, we know that BPOM all over the countries vary. Like even in these good countries, the highest quality would be only in the state with a minimum capacity to produce. They also dismissed our POI about countries with minimum infrastructure, meaning that even they concede that countries with minimum infrastructure, like Afghanistan, are prone to defects in manufacturing and they have no way of handling that situation. This kills their justification point on the supposed safety for citizens. And it's too idealist at the end of the day. Okay, moving on to our counter mechanism. We believe that instead of disallowing patents, we would give a more effective solution to this problem. We would subsidize urgent products like vaccines that need to be given right away. For example, subsidies from the IMF and international relations. For example, how Korea bought Sinovac doses for Indonesia. This is likely to happen. Why? Because countries are willing to help one another for mainly two reasons. One, to strengthen their political ties with one another. Like when they're shown to help another country, they're obviously going to be seen as better in the public eye of the international community, as well as have more better relations. No, thank you. I'll take that later. For the comparative advantages that every country has. But two, they also want to show a moral obligation that they are fulfilling. We believe that if it isn't urgent and there are no subsidies from the IMF and other parties, we would regulate these pharmaceutical companies that are expensive with a reasonable subsidy so the company doesn't die at the end of the day. So we think with all these reasons, we're actually better accounting for these types of situations. Moving into my arguments, before I do my arguments, I'll take one POI.
if your concern is supervision, literally on our side of the house, these developing countries can use the same ingredient that you say are very well supervised by the developed countries.
I really don't understand what your point is, being the fact that just because they have the materials to do this doesn't mean that they're actually going to be able to manufacture and produce it the same way. Like, just because you're handed a recipe and some bread and flour doesn't mean you're going to be able to make bread. Moving on to my arguments. The first being why this proposal is harmful, and the second being our exclusive benefit, which is better health advancements. First of all, why is this proposal harmful? Take note of the characteristics of the main actor in our debate. These are developing countries like India and the Philippines, who by nature have weak economic strength and a lack of human resources, as well as minimum infrastructure and plenty of citizens to account for. They have thousands of citizens. They're the countries with the biggest population numbers in the world. With the proposition's proposal, there is no guaranteed effectivity. Why? Because producing pharmaceutical products is no simple task. They may say that supervision is good enough, but the reality is that it takes machinery, medical and mechanical expertise, and materials, all of which these developing countries are not guaranteed to have because in the first place, they're developing countries. Just handing Africa a recipe isn't going to ensure that the civilians on the ground are getting access to a good quality medication that will actually bring benefit. The harms of this is four. First of all, these countries are unable to produce their meds effectively. They need to produce with the limited facilities they have, and this may either result in one, the production taking too much time, which is not only going to waste time, but also hurt too many civilians in the meantime. And two, a costly trial and error process that these countries do not have the money for. Even if you were to say that these countries are willing to try, the money that they have to reproduce things that may fail in production are still not good enough. There's still a likelihood that at the end of the day, the stuff they produce aren't as good enough. And that is completely logical, considering the fact that they're developing countries with minimum infrastructure and minimum human resources who are expertise in these scenarios. Two, these countries may struggle with the supply of ingredients. They have a lot of citizens to account for. Take note that even the biggest companies often face shortages of supplies of materials. And we believe that, especially in the case of developing countries, they will struggle even more with the supply of ingredients that they still have to buy, that they still have to find and allocate for, and make sure that they don't waste it in their trial and error process, which is guaranteed to happen, considering they have minimum pre-existing knowledge about these types of scenarios. Third of all, it's medically risky. This is where propositions claims about the better safety for citizens is bad. Because falls apart. Because a batch of Sinovac at its local company, for example, needs to be retested dozens of times just to ensure the safety, let alone a weak economic country who is rushing to apply their thousands of citizens, coupled with the citizens' demand that are pushing them to produce it as fast as they can. The government may not want to hurt their citizens, but there's a high likelihood for accidents to happen that will come at the cost of lives, and proposition needs to account for this. It's very likely that they will spread possibly ineffective or harmful medicine. First of all, this disincentivizes other countries to help. Why? Because these other countries see that these developing countries already have the advantage of not being forced to use these patents. So even if the country that is if those developing countries are struggling to produce or struggling to sustain themselves, other countries are going to see them as already having an upper hand in the first place, and they're not going to have the interest to help them as much because at the end of the day, they will rely on the ability of those countries to produce it for their citizens. That's why this proposal is so harmful. Moving on to our second argument, at the end of the day have better health advancements. Panels, notice that companies are the only and most important actor in medical advancements. They are the only actors who are consistently devoted to creating these types of medical advancements that can save lives and maybe at better and cheaper costs and more efficient productions at the end of the day. However, in status quo, these companies are still learning. There's still vaccines that don't work properly, for example. In order for upgrade, these companies need to do research, which costs a lot of money. Proposition might say that developed countries may be able to pay and cover the costs that are being eaten up by developing countries, but they don't necessarily have the interest to when taking into consideration that they're investing in potentially ineffective medications. Like the amount of money that they put in is likely to result in medications that hurt people in developing countries because the country is unable to produce it effectively. Also, take note of Pfizer in Europe, where not every country has a good relation to Europe, for example, Saudi Arabia, so they're not able to sustain the medications that are needed in a certain country. Countries will only help other countries that benefit them, and developing countries don't have as much of an upper hand, especially when they have patents in the first place. On companies, this is the biggest harm of all, because first of all, this harms their income. It may sound silly, but the reality is that companies are not single entities. They have shareholders who are waiting for the income as well, and this will push the shareholders to invest in their products and get more advancements. If they don't get income, they're less likely to invest, and therefore these corporations and companies are less likely to make medical advancements. Second of all, it reduces the exclusivity of their products, which kills competition. We know that these developing countries are less likely to steal data, but other countries are able to steal data from those countries. For example, in the instances where Russia and China were able to steal medication recipes and therefore develop their own, thus killing competitivity in the sectors of medications. So proposition reduces the likelihood for companies to have any sort of incentive at the end of the day, which results in the worst case of having minimum medicine to be able to be given to citizens at the end of the day. On our side, we have advancements because we first of all sustain the quality, which is the most important and integral part of medication at the end of the day. So even if these companies receive medication a bit late, at least this medication is guaranteed to save their life. At least this medication isn't going to poison them. Two, if the corporations improve with their medical breakthroughs, there will be breakthroughs and made cheaper and more qualified meds like the rubella vaccines. And third of all, we have better health advancements. In the worst case, this doesn't happen. We still have the quality, and this is the most important thing in medical treatments. This is an exclusive thing that we have on opposition. We believe that even if people can't access medicine, it's okay because it's worse on opposition where countries are unlikely to produce and there's a likelihood of our mechanism. For all these reasons, we believe we've won. We're very proud to oppose.
Thank you to the leader of OP for that speech. Now I'd like to welcome the DPM to deliver theirs. You're here.
Is my voice audible?
Yes, it is.
Okay. For POI, just unmute your microphone. Thank you. Starting my speech in 3, 2, 1. Two things that I'm going to bring in my speech. First issue on is the medication qualified or not under our side of the house, and second issue on why the producers will still be benefited under our side of the house. So first issue then, is this medication qualified or not? So the entire argument is basically contingent upon that these products are going to be lower quality anyways under our side of the house because these kinds of developing countries are not able to actually create these kinds of medication, and that's why it's not going to be beneficial, right? But the few responses under here. First response on 2, right? Realize that the whole entire argument is contingent upon how developing countries cannot create these products, right? So if we prove to you that they are at least capable on actually following the patents that are already available and are already created by these big pharma, we immediately win this point and their claim falls, right? So how do we prove that this is actually capable under developing countries? Realize when we're characterizing patents, it means that this is what regulates the ingredients being put to these kinds of vaccines or these kinds of medicines, right? We think that this means that in order to actually follow these patents, in order for these kinds of companies in pharmaceuticals in the developing areas to actually follow and actually listen towards what the patents that are actually created say, they need to follow 100% on what these kinds of developed countries already produce, right? We think that why we actually remove these kinds of patents in the very first place is because we want these kinds of pharmacies under our side of the house to actually be able to actually follow the ingredient that developed countries already produced since the very first place, right? We don't get why this will be a harm because under our side of the house, the recipe is already created, and these kinds of developing pharmaceuticals can actually just follow what is already created without actually being stopped on just because of a patent at the end. But second response then, even if you can't believe that, let's just characterize medicine inside the country later, please. Realize that medicine inside the country is something that is super detrimental and super important, right? That is to say, when something bad happens or a certain medicine is, for example, ineffective, it can cost someone's life, right? Realize that this is where countries would likely put regulations, where government will have the responsibility to protect the people. Realize that this means that at the bare minimum, it's super likely for them to actually have a certain amount of minimal regulation at the end of the day. Realize that the moment we're talking about regulated, this means that regular checks needs to happen and will happen in these kinds of developing countries at the end. This is like having a minimum amount of ingredients for it to be considered valid. For example, we think that this is already enough to actually ensure that the product is at least okay, right? This is where these medicines will still be okay in the very, very worst case under our side of the house. We don't think opposition can just bring countries that are already too far gone, like Afghanistan, for example. Realize that under their side of the house, you cannot even protect these kinds of actors anyways, right? Realize that these kinds of countries that are already so bad and also already so broken cannot even do trade and distribution coming from these kinds of developed countries with the big pharma and the patent anyways, right? We don't get where you're trying to champion these kinds of super minuscule and super nitpicky example at the end. But there's response then. Even if regulations don't exist at all, and we take the worst case under the house, No, thank you. Firstly, realize that these companies will still want to save face, right? That is to say, in order for them to always continue to gain income, they need to actually save their own reputation. They don't want their name to be tarnished just because their medicine actually kill a person, right? We think that this is unlikely to happen, and in order to maintain their reputation, these kinds of companies will still want to make the best of their products at the end of the day. But for response, even if it's going to be that bad under our side of the house, let's just flip their case with this is flip their claim, right? I think the quality will not be maintained on
Hi.
their side anyways, right? Later, and even worse implication at the end. Let's just characterize how these pharmaceuticals will react without any competition. They will feel like they're invincible because of two things, right? Firstly, there's no other pharmacies producing these products they are selling. Secondly, patients have no choice at all to not buy the product. When we're talking about medicine that costs life and death, people will be forced to purchase this product at the end of the day. This is where there will be no incentive or no innovation to maintain quality under their side of the house for this patent owner, right? Let's just characterize big pharma. We think that they're part of big companies which are profit oriented in order to make their business run, right? Where under their side of the house, the quality will just be stagnant or even lower towards the bare minimum standard, right? And these companies are free to make their products more expensive, for example. This is bad towards accessibility for their people under their side of anyways, right? Comparatively, at least under our side of the house, they will still be accessible. These products, although it's very the bare minimum, it's still okay. And under our side of the house, at least it's accessible. Their burden still stands, right? But before moving on, I'll take a POI.
I think when it comes to like a pharmaceutical company, it doesn't talk about ingredients only, but about also the skill of the workers, also the technology and whatnot. But holding all of these things are costly for the company and for the state, also in the long run. How do you deal with that?
Look, then the question becomes, what's the difference under your side of the house, right? The difference under your side of the house is that patents will exist. Characterizing patents, it means that only a certain big company, which is likely the big pharma on developed countries, are going to be able to actually create these kinds of medicine anyways, right? So under your side of the house, these kinds of developing countries, pharmaceuticals, cannot even have the chance to actually try and make this medicine at all, right? At least under our side of the house, we still have the advantage of them actually trying to actually replicate the products. The moment there's no patents anymore, they are free to make this product without actually being regulated by the government to not actually do that. We think our side still win and is still marginally better. But secondly, they talk about how trial and error will be bad under our side of the house because these countries apparently don't have the capital, right? But first, a few responses to this, right? First response, realize that you're just pointing out your harm, right? The harms of trial and error will only happen under your side of the house, right? Let's just characterize what will happen under opposition. Realize that the moment patent will exist, this means that only a certain company that put up the patent in the very first place can actually produce the products that they are patenting anyways, right? This means that at the end of the day, pharmaceuticals under your side of the house will always be forced to create new innovations and new ingredients to actually go through and create new vaccines, for example, that can actually cure the COVID-19 because a certain vaccine are already being patented and they cannot create this product at the end of the day, right? This means that inherently under your side of the house, your burden is actually bigger on proving why these kinds of developing countries that actually have these kinds of lower resources anyways can actually produce and to actually innovate that much in order for them to actually just create a certain vaccine that is already accessible in a developed country by the big pharma anyways, right? We think that this is the way less way less trial and error under our side of the house. We're not actually trying to innovate and we're just replicating what the developed countries and under our side of the house actually is doing in order to actually make products that can actually be vaccines or medicines at the end of the day anyways, right? But second response then, even if in our worst case scenario where the production is not going to be following protocol, we see that at the very least they have achieved the bare minimum of benefit, which is an adequate production at the end of the day, right? Where we say that at the end, even though we're actually taking some amount of the resources under our side of the house, at least these resources will be efficient every single time, where we just follow the ingredients that are already existing, follow the recipes that are already existing, and we say that it's already enough. we win on the first point, right? But second issue then, why producers will still benefit under our seventh house? We told you that researchers who create medicines won't get the advantage of producing a product. This will lead to the products dying, right? Firstly, and to realize that they will still be able to gain patent rights from the developed countries, right? We think that this is enough. The moment that developing countries, in the developed countries, they already have advantages to begin with, and this is already enough income at the end of the day. But even if it's true, no explanation at all on why people will suddenly stop buying from the original companies anyways, and that's why we win on the second one. Thank you.
Thank you to the DPM for that speech. Now I'd like to welcome DLO to deliver theirs. Here. DLO?
Yeah, sorry. I think yeah. Okay. Okay, my speech will start in 3, 2, 1. Let's first clarify our mechanism. It's clear that the proposition has failed to notice our mechanism. Our first speaker has said it already explicitly. It is disallowing patents, so we would subsidize urgent products like vaccines and subsidize them like in IMF and international relations. This is likely to happen because other countries are willing to help one another in order to strengthen political ties, right? Not just to show, and also to show moral obligation that they are fulfilling. If this isn't urgent, there's no subsidies from EMF, and other parties would regulate these kinds of pharmaceutical products that are expensive, right? First of all, before that, my 2 points of rebuttal. Why is it still within the interest of companies to get profit from patents, right? One, safety net. This means that in order for you to run a company, it is important for them to be safe, right? In times of crisis, every company needs to lose money. That means that they need extra. It is always safer to have more money. That's why it's important. That's why it's within their incentive. 2, these companies that create patents can create innovation. So this means that these companies are likely to create innovation in newer pharma products. And this takes time and money to do this, right? So that's why we think that it's important for them to have this money. Okay, they talk about the regulation thing that they will have under their side. We think that their regulation is unlikely to work immediately, right? In order for some medicine to work out, you have to see the harm, right? It can come for months, and it's going to be too late to even stop until they see the harm first. So you're going to hurt the people first and create regulations. So we think the harm still exists under their side with the regulation that they have, and it's ineffective. Okay, let's characterize what kind of developing country we're playing in. They have money, but not as much as developed countries. There are countries like Indonesia, Philippines, and etc. Yes, companies have incentive and good image. This means that they want good quality products and being accessible. So this means they actually approve of our arguments. So moving on to my substantive, I'll separate it in accessibility and quality, right? We will be able to still distribute pharmaceutical products. Why is it likely? Because we have alternatives, right? It is unlikely for developed countries to create very expensive products in order to get profit, right? Because they think that if people cannot afford these kind of products in the first place, they can't profit. So if they have the incentive to not, make it too inaccessible, understand that these are still likely to be accessible to people. Because if not, they're going to receive backlash from the companies, and these companies don't want this, so they can't accommodate. In the future, pain is going to be profit oriented. So it is unlikely for these companies to want to compete due to profit. And this is not all just the best thing, but it's also the most accessible, right? This means that because there are other existing pharmaceutical products that can vary from company to company, they're able to compete on people who actually can make different products to different individuals. And it's who is going to be most wanted by the buyers, and this is going to also be accessible to people, right? So in comparative, under their side, their company does not have the incentive to sell to developing countries because they are not going to buy their products in the first place because they're already they're not patent, right? So what this means is that they're not able to
Don't you think it's unimportant for these companies to actually sell to these developing countries anyways, the moment we actually have local pharmacies creating the same stuff anyways under our side?
Okay, see, the problem is with that local competition is that they're unlikely to be ineffective in the first place, right? When you create too many things of the same product, unlike the companies themselves, they're going to rate A. That means the competition that you get is not going to increase the quality in the first place. It's going to instead just be the same. So you do not get that benefit. You do not get to compete under our side, right? With comparative under their side, there are too many competitors that try to copy their products instead of compete, right? So we think that's why our companies have the incentive to make it more accessible. Okay, we're gonna have some alternative to why we have like better quality. Okay, why is quality better under our side, right? Companies have more expertise. This means that you have better quality products. This means that you have money and you get resources in order to create these kind of things. This means that you are able to give the best quality medicines, and due to the competition that exists, due to the resources that these patent gives, they can give this, right? Just like any other competitions, there are potential buyers that are likely to get back in for competitions, right? In developing countries, they tend to be vulnerable, yes. In comparative, on our side, under their side, developing countries cannot recreate this because they have bad quality. This is very unlikely for them to have the workforce that is needed, the quality of the workforce, and the ingredient also. Because this is coming from a foreign land, this means that the ingredient is still unlikely. Although you are able to get some, you're not going to get all of them. You have to at least ask more international help to do this. And we think that's going to be even more unlikely on their side. I'm going to answer later, right? So it's unlikely for them to have good quality. In your side, they're going to be bad quality because you need trials and errors to do this. You need to have money and resources, so although they have the ingredient, right? So there's so many process to do this. It takes time and money, right? So because they have less time and money, it's not going to be effective in the first place to create these kind of things. So this means that it takes more time to research. So, and it's not just like one research. They are also going to fund the research over time, years over years, to improve the quality, improve recreation. Just because you're getting the instruction and also the ingredients does not mean you can always immediately create these kind of things. But right, this is unlikely in government, right? Why is quality important? In the worst case, we have to defend the trade-off of accessibility, right? Your body is something that is dear to you. A medicine that has bad quality is likely to do permanent damage to your body, creating an irreversible damage to your body. So we think it is unjust for government to say that, oh, it's okay for us to create possible like bad medicines in order to help the majority and in order to create quote unquote accessibility. I'm going to explain why it's still unlikely in their side. This means that you're going to create internal problems in their body. We think this is evil, and the possibility of something going wrong within somebody's body is something that no one wants to have, right? Opposition has to justify this. And even in the worst case, that accessibility is not going to happen in our side, it's going to be worse under their side anyways, because in the best case that they have the ability to create these kind of medicines using this patent, they are unable to get national help. Why is this important? Because developing countries are likely to be facing a crisis that they can't fix by themselves, right? In order for them to do this, maybe they have the recipe for the message, but they do not. So because they already have the recipe and the ingredients, they're unlikely to get help from these international community because they are less they have less incentive to help, right? First of all, it's unlikely for you to get these ingredients in the first place. Second of all, in the best case, these internationally help in the government side. They're only giving ingredients, right? Developing countries are unlikely to get good quality or enough workforce in times of crisis. For example, in COVID, right? It's very unlikely for you as a developing country to have all of this, to be able to manage all of this, and become more accessible in the first place. So in comparison, we have money, we have quality and accessibility, and we have traded off why it's okay to be slightly inaccessible, and that's why we are proud to oppose.
Thank you, Diallo, for that speech. Now I'd like to welcome Government Whip. Here.
All right, POI, unmute. Gender pronounce he, him. All right, I'll be starting my speech in 3, 2, 1. One extraneous rebuttal before jumping to my clashes, right? When it claim on how, oh, no countries outside will help, like the IMF won't help. Three responses, sorry. First of all, panel, literally, we got no likelihood regarding this. Literally, WHO or like WHO, which is literally responsible for all global health issues, medication, we don't get why they suddenly won't help, right? Literally, when we're talking about vaccine, for example, like in COVID, WHO will always try to check every vaccine made in status quo, right? But second response, inexclusive. Then IMF will exist under our side of as well, right? What makes it better under our side of the house? This money will be used to produce more medicine by the local developing countries' pharmacy. Why is it better? Because local pharmacy company products are more accessible. Where market segmentation exists means there are cheaper products for low-class people and still have the normal expensive products for the wealthy people. Moreover, there needs to be distribution costs at all, which happens in opposition, right? The moment you need to import the products in a higher price, so side opposition can't just run away with like a cheap product, right? But third response, even if we have no countries helping, we're fine with that, right? We're defending the replication of medicine to always make it cheap, right? Not inventing a new medication, right? We already told you from PM. And other countries are forced to, for example, and we're not trying to make other countries forced to make a new vaccine. We don't try to invent a risky, huge medicine. Anyways, we don't need that tight supervision because we're using the products and the main ingredients just like the developed countries. With that, I give you two clash. First of all, talking about the companies, and second clash, why we still uphold and have the quality that is accessible for the middle to low and developing countries. First clash, talking about the companies. They talked about how, oh, we don't have the companies won't have investment and it will harm the shareholders, right? Two responses. First of all, panel, we got no likelihood regarding why the shareholders are super detrimental for the big farmers anyways. They have a bigger alternative source of income anyways, right? But yes, POI.
Current drugs is not it's not something that effective that need to be to not have another research in advance. Do you think that developing countries can continue that research?
Panel, we told you how literally making like a competition, when we told you how competition still happen, literally they always incentivize, for example, to be supported by the government, for example, because they have the idea to actually help the citizen to make sure that the citizens are accessible when it comes to medicine, right? We think it's very much possible when the government, for example, prioritize their allocation of funding, for example, to prioritize health when it comes to like COVID-19, for example, it's very much easy to allocate the funds, right? But second response, even if we have no investment, it's fine, right? Literally, that's where you have competition, meaning these investors can also invest on these small companies on the developing countries. Why? Because investors in status quo are always attracted to every innovation that we told you about, right? That this medication made by developing countries are going to be made similar, but cheaper, for example. That is going to be attractive because it means you always attract society to buy this medication that also make the investor want to also invest on our side of the house because of how the consumers are so huge, for example, and it's attractive for a lot of people because it's cheap, but you can have a qualified products. Comparative is, even if you don't take any of our responses, where we still need to protect the individual, we still are happy to take the trade-off. The question becomes this: would you rather defend the big pharma that has capital anyways, or individuals on the ground that cannot have access to big pharma products, right? It's clear we want to make sure these individuals actually have access as quick as possible. This is where our side takes a debate by at least tackling the time sensitivity issue that exists when it comes to medical problems. This is exclusive because their side relies on arbitrary factors, right? Why big pharmas will suddenly distribute to developing countries anyways, right? We still question why there's no such thing as, for example, transportation and import fund, which is so expensive, especially when we're talking about US and Indonesia, which is like coming from like the opposite side of the world, like developed and developing countries, right? So we win the first clash, right? But second clash, why we still uphold and have quality of the medication that is still accessible? What did you get in response? They talked about how BPOM and supervision is not going to be as level as the developed countries. It's going to be expensive and we don't have supervision, right? Three responses. First of all, let's just point out how BPOM or any supervision on medication that literally talks about lives of people is so sensitive. What does it mean? It means when the concern is literally safety and lives of people, it is literally going to be the number one priority of these developing countries and the government, right? The government will always maintain their citizens, of course, maintaining their health, and the medicine company of developing countries are literally still going to maintain their reputation to not be boycotted, maintaining the loyalty and reputation so they attract consumers still, right? But second response, okay, even if the quality isn't as good as the developed countries, literally our side, these developing countries can use the ingredients that you say are very, very well supervised, right? Literally, medicine has always been never effective in status quo, just like the vaccine anyways. It was never meant to be perfect, but it was enough for like bare minimum. For example, the vaccine effectivity, like 60%, it never was meant to be perfect anyways. So the supervision can be accessible when we told you how the vaccine and the medication doesn't have to be perfect, but at least it can be reached like the bare minimum, right? Because there's funds coming from developing countries. Developing countries can prioritize all these funds. We don't have to make it perfect. Their side was very ideal on always claiming that the medication have to be perfect, right? But the response, even if supervision is so expensive, panel, then this proves to you how opposition is going to be much more worse, right? Why? Literally, panel, the supervision on op bench is going to be the reason why the medicine will be so expensive, right? Why? Literally, panel, I think this big medicine company will try to always hire huge supervision, right? But look, compare that though with our side of the house. When we try to make that medication just like the medicine company on the developed countries, sure, we duplicate it, but we make it cheap, right? We don't have to waste our money to literally test the whole same products again because it's going to be just the same quality of the main ingredients, right? Because we're using literally the same ingredients, right? But that doesn't mean we don't do any testing, right? We still do it, but what's the difference on our side of the house? Your price is cheaper because the testing looks like making the vaccine cheaper, for example, but using this main ingredient. So it's not going to have to make a new invention of medicine that's going to take a lot of funding, right? All the ingredient supervision are already made by the developed countries. We think it's not going to be as like the supervision is don't need to be like as significant. We want to, for example, making sure that the ingredients are, for example, not as huge as the medication, but still cheap, for example, but still have a similar effectivity like the developed countries, for example, right? But second of all, when you talk about how the company won't make it too expensive under their side of the house, one response, opposition misses the idea. Not expensive means coming from a literally developed country standard, right? Which is likely, right? Because the main consumers are going to be the ones living in the developed countries, right? Because it's literally the company that made this company in the first place coming from the developed countries, right? The standard of price have to be the average of the consumers also coming from the developed countries and society, right? Which most of them are middle to high, right? What does it mean? It means the standard are going to be still expensive because the standard of price comes from middle to high and the society of the developed countries, right? Especially when the companies start off from these developed countries in the first place, right? We think even if like the price is going to be cheaper, it's going to be this average of like the consumers, right? Which literally is going to be the developed countries first because it's literally all over the developed countries, right? The consumers are literally coming from the developed countries because the company are literally made from developed countries. It's all widespread in the developed countries, while developing countries are not going to be spread under opposition, right? So the average is still going to be the majority coming from the middle to high class people from the developed countries. Let's just do some weighing here, right? Our worst case, the country don't have the high quality medication, which we told you is fine because medication never was meant to be perfect, which we told you from DPM, which means the bare minimum quality is already enough, right? Especially when opposition say that our supervision won't be that high, we think it's already enough to reach the bare minimum, especially when we told you how WHO, of course, want to help us, right? When it comes to citizens' health and safety and responsibility of the government, right? But opposition's worst case is much more worse because it is very time sensitive when we're talking about medicine, meaning a lot of people get sick, but opposition don't let these people get the medication. The accessibility isn't happening for the medication. It's so hard under their side of the house, right? Why? Because developing countries aren't capable yet to create a new invention different than literally the developed countries, but they can operate by, for example, having the basic developed countries medicine, but they modified it under our side of the house. But at least we have the main ingredient that are still safe made by the developed countries. I'm so proud to stand on quarterfinal.
Thank you to the government whip for that speech. To end the substantive speeches, I welcome Op Whip. Here.
Hi, I just want to make sure can everyone hear and see me properly?
Yep, both.
Okay, thank you. Let me set up my timer. Gender preference he or him, but I'm gonna be so happy for you to approach me through my speaking position. That is web. Oh, what else? Oh yeah, POI preference. Just don't hesitate to unmute yourself because I'm not gonna see the chat box. And also, if I'm cutting off in the middle of my speech, just feel free to interrupt my speech because I'm also don't want to see the chat box, so I cannot know if there's any problem. Okay, hence I will start my speech in 3, 2, 1. Proposition case are intuitive, assuming that all countries can do such a good breakthrough just because you lose those kind of patents. Understand that in order to win, they need to also play on the scenario that making a drug is not only limited to natural ingredients, but also the workers, for example, that needs also skill or maybe technology that not all countries can fulfill. Even in my POI, for example, all of their response to my POI are mostly intuitive and only dismiss our case. That's so proud to oppose. Hence, before I move into my class, I'm just going to clarify and frame several things why props should lose the debate. Number one, they only play on the case that it is an urgent situation for developing nations like pandemic and what. Unfortunately, this condition is unstrategic because the conditions are only temporary. That means they need to also defend the condition after the pandemic, as the motion doesn't specify it only to the pandemic condition. But secondly, their burden are extremely big. Why? Forcing all developing nations to make their own product and always compete are exactly costly and bad. Why? It is extremely difficult to be done because not every country can do such a mass movement like that. Look at the fact that even countries like USA, for example, still get support from other countries. Prove to you that you cannot make everything on your own. This is a justification that they never answer to their whip. I think it's too late to be done in their reply. But third, their whip literally contradict their own case by saying that it is okay to have not a perfect medicine, because when all of your speakers say that you need to have a qualified drugs and the high quality drugs, for example, even though it's expensive, you destroy your own case on side proposition. I think they lose the debate. Hence, classes. I'm gonna play on two things. Number one, I'm gonna play on the issue of justification, on the principle of why is it justified for you to do so. Now, number two, I will talk about how later the pharmaceutical industry will look like on both sides of those. The first clash under the idea of justification. The first thing that I get here is that our company have already had the big capital. True, but then the question is how long they can survive, because you and China cannot always subsidize the Sinovac and Moderna, for example, in the long term, because they also have another concern. Like Biden wants to expand education in rural areas, or maybe the development of their own countries. More than that, because of allocation of money in government are so diverse, you cannot assume all the funding can be allocated there. The second thing I got here is the Sinovac will only be accessible for China. That's why Indonesia should have their own vaccine. Exactly, this funny because they forget there are free markets, there are international relations. The fact that even Sinovac also entered Indonesia, that is to say, it's still likely for international relations to happen and whatnot. Before that, yeah.
So if you say that, adequate and bare minimum medicine is not good, then you want to make it perfect, right? So how is it going to be accessible if you want to try to always make it perfect by 100 tests of medicine, right, under your side?
Because exactly we say that there's a research that comes from the company, for example, that is extremely important. But in order to run those kind of research, you need profit. The thing is that developing nations not only have no money, but also they have that kind of skill and the resources that can do those kind of research to improve your vaccine, for example. That's why it's better on our side. Hence, the second thing I got here is that the research will be easier for developing countries because it give the education to rise and being independent. Number one, it is untrue because most of developing are now under number one, have the bad education, that is to say bad human resources. Secondly, bad facility, and third, bad system like corruption and maybe bad morality, like what happened and affect their country, like maybe India, for example. Having the vaccine just because you just have the receipt doesn't mean that you can have the same skill as the workers and the company like Sinovac or Moderna in US. That means that in order to get the qualified drugs, you need to also recruit the foreign workers, for example, exactly costly. But even if they have those kind of benefits, I think the benefit is short term because most of the time sustaining the quality of vaccine is and of the technology, for example, is so costly. That means that if you want to be independent, you need a strong capital to sustain the long run. That means that it is irrational to be independent in the long run for developing nations. More than that, because you now cannot just stop producing drugs because you already have those companies. I mean, you will be tied on those kind of things that you should produce and you should fund all of those things. The next thing I got here is that all countries can make a policy to look good, for example, and save their people. Exactly because of this, it will pressure your countries. For example, you will force the countries to fund and the pharmaceutical company and sacrifice other sector that is education and maybe national economy that also vital for countries, and you cannot deny that. Understanding the concept of the states is also diverse. You cannot just reallocate every money only for a pandemic. The fact that also the small business is also affected and whatnot. That is to say, you cannot reallocate that easily. But when I POI to their second speech, they say there's no difference in your side. Number one, it's so dismissive, but number two, there is a totally difference because we say there are tons of mechanisms and status quo for developing nations to afford the products and the qualified products like maybe Moderna and like Pfizer that owned by US and Europe. But I got point the best case scenario, they're talking about accessibility. I think the accessibility on their side is still unjustified due to how important the profit for the company. Why? Because this kind of company need to run their business. That is to say, on your side of that, not only necessarily you will like lose a certain amount of qualified drugs, but you also kill this kind of companies like Moderna and one that also need money. They need to run their business because they have, like for example, technology advancements and better competition and higher quality. Why is it important? Number one, this kind of company will realize to the money they have. In order to make a better technology, for example, and better vaccine, without this profit, they will not have any advancement or maybe potentially die, or maybe at the very least, they will not run this kind of business anymore. That is to say, in your best case scenario, yeah, you might have the unqualified and like current vaccine that like not 100% can like cure COVID, but in the worst case scenario, you will lose this kind of companies, for example, that don't want to run their business anymore. That means you have no backup like to do your research again. But the second thing, why is important? Understand where developing nation utilize it sometimes also bad because development are also bad in system. They cannot get any other benefit about accessibility as well. The thing here is that when you have this kind of patent, and a company go to the stage, for example, like they go to Indonesia, like what happened to the Sinovac, they mostly have more technology and system to help the government distribute these kind of things, because like government also have the bad system, like maybe in Pakistan or maybe like in the Middle East, for example. On side propositions, this kind of company will never help the developing nation in terms of distributing. They will assume that all developing nations are capable in distributing it on themselves. Like for example, if there is like Indonesia that's really diverse, for example, I think when they have the less capital, for example, and bad system, I think it's impossible for them to do that. But number three, even if they have any of their benefit, for example, I say that the benefits are short term. Why? Because sustaining the vaccine and the technology mostly are more costly rather than just purchasing the new one, for example. Especially when there's no company that want to produce and they only produce the best products, for example, it will be costly for the government to develop to keep those kind of products and those kind of technology. The comparison is better on our side because we have company on our side and we still have the good quality of product that might be costly but less expensive to be sustained because like the quality of already good, because of like already like a lot of research and whatnot, advancement and whatnot. It's important for the long run compared to proportion they want to have this kind of short-term benefit. But second question, I'm gonna play on the practical ground. I'm gonna be charitable now how the vaccine will look like on yours. The first claim I get here, you don't need to rely on one company. The question here is that there's not any significant harm coming from relying on one company. I think the reason why the company want to improve because they have consumer like loyal consumer and whatnot and the segmentation. So if you rely on Sinovac, you will mostly force the Sinovac and like demand them to make the Sinovac improve. That is to say there will be no harm coming from it. I don't see any urgency. Why should we rely more than one company? But secondly, the thing on the competition, for example, we flip this argument by exactly say the competition is better on our side because the sense of competition comes from the companies that have uncertain profit and consumer. But when your competition is based on the states, there is no any benefit coming from the competition because the consumer are concerned. For example, Indonesian consumer will be Indonesian only and not changing to other countries. That is to say the competition is way more on our side because it's based on the company that have uncertain consumer, for example, compared to the states. But I'm gonna play on the worst case scenario. The technology are so expensive. Three things. So I said, okay, number one, it's not gonna happen because there's a market segmentation. This is my second speaker characterization. In the future, when all companies are competing with one another, there'll be a spectrum that target upper class and lower class. For example, also because we already improved the companies like Sinovac, for example, that target the lower class countries and can have the better quality with the same price because they already improved, like what happened in status quo. So it's more likely to have the market segmentation and the more cheaper vaccine, for example. But secondly, even if we don't have, it is fine because we still have the quality. The help from USA and China or your allies like Korea to Indonesia, for example, there are a lot of assignment and status code that can help you to purchase it. But thirdly, even if it's too expensive, for example, it is fine because the comparison here is that we still have the good quality of medicine. The tipping point here is that regardless of the harm and benefit, sustaining the quality of the medicine is extremely important for a state because talking about people's soul and people's life. And proposition the best case they have is they have company and their own country, but how can they sustain it? How can make sure that's the technology in the country can be sustainable and eco-friendly, for example. So proud to oppose.
Thank you to the opposition whip for that speech. Now we'll get into reply speeches. I now like to welcome opposition reply. Here.
Okay, I'm starting my speech in 3, 2, 1. Panel is a team that wins this debate. It's a team who can actually give sustainable benefits that don't come at the cost of lives and minimize harm. We believe that on our side of the house, we're able to fulfill those things. And we believe that we won this debate based off of 3 clashes. The first being we're better able to protect vulnerable actors. 2, we actually have medical development that is sustainable. And 3, we're successfully accounted for our trade-off. So proposition tries to play on a case of these countries supposedly having perfect infrastructure, regardless of the fact that they're developing and economically struggling, and that they're somehow, with the key of the patent, they're able to produce foolproof medicine that isn't going to cost any lives at all. That is too idealistic. We win the first clash because we're better able to protect vulnerable actors. On proposition, they're sacrificing citizens to prioritize short-term solutions that are risky and unreliable because people who are sick can be even more sick or maybe even die and get permanent injuries when they take in the medicine that is being produced by countries who don't have the infrastructure and human resources in order to produce it in the first place. This is very unjustified and they never defended it. On our side of the house, at least we protect these citizens because we are able to give them medicine with better quality under our mechanization, where we've shown you the likelihood of people actually getting good medicine. And we do not, in any instance, inflict permanent harm onto them at the cost of a short-term benefit that is unlikely to happen. Because under our side of the house, they're able to get actual medicine without the cost of these developing countries trial and erroring away at making medicine. We win at protecting vulnerable actors. But second of all, which side actually sustains medical development? On proposition, you're essentially killing the incentive for companies because these companies are literally giving away their exclusive, costly patents that took years to make to developing countries at the risk of leaked patents where other countries can steal them and reproduce better medicine and make researchers on their patents, and they can lose their investors, which are the key to them actually making more progress in the first place. Proposition tried to say that companies are getting too much profit anyway. So that we say that we, first of all, we mechanize our subsidies in the case of this happening, meaning that we're not going to allow companies to oversell at like extremely dangerously high prices, as well as the fact that the proposition also said that these companies want to save face. Then why would, in an instance of a company wanting to save face, would these companies then sell things at like ballooning prices? That's not reasonable. Second of all, in a reasonable way is our mechanism, because at least shareholders will still invest in future developments. Proposition tries to say that the competition will still happen because these investors will want to invest in small local companies. What? As if big investors are willing to shift from Sinovac to a small unknown company. As if small local companies can take over superpowers like Sinovac in supplying medical development internationally. There is no big probability of this happening simply because it is unrealistic. On our side of the house, at least companies still have the incentive to develop and potentially develop cheaper and safer pharmaceuticals, which will benefit these developing nations at the end of the day anyway. So on our side of the house, we sustain this development. And it is very important that we sustain this development because it ensures any probability of medical progressions happening in the future for better medications to exist in the future. And proposition neglects this with the purpose of a short-term gain. We win on sustaining medical development. But third of all, the trade-off. On proposition, you essentially have the high probability of bad quality that can permanently harm citizens. They tried to counter this by saying that there's check and balance. We say that it's costly with the money that developing countries don't necessarily have in the first place, and with the human resources they don't necessarily have in the first place. And it is not guaranteed to actually benefit and succeed because a lot of these countries are under pressure with their citizens, forcing them to make the medicine as soon as possible. There's a probability that their citizens will protest if the medicine takes too long to appear, and they can't risk that. This also comes at the cost of trial and error, which will happen at the end of the day. Second of all, there is a small likelihood of this happening because companies want to save face. We don't think that's true because companies, when they give their patents away, they're essentially putting their hands up and away from this responsibility. They're giving this patent to another country, and if the country is going to mess it up, then that is the fault of the developing country and not the corporation. They can simply walk away from this. On our side of the house, we have accessibility. We may trade off from accessibility, and we can see that it is okay because we mechanize already that we're able to have the medicine if it's urgent. One, if it's urgent, other actors will help with pre-made medications, and we explained this from the very start. The proposition kept acting as if our meds were also a jumble of recipes with no guarantee of succession. Second of all, second speaker told you that the regulation isn't going to be effective anyways because it takes time to create regulations, and that means you're going to harm people first because you have to wait for the harm to happen. And third of all, even if we don't get it, at least we aren't getting extreme permanent harms at the cost of lives that is happening on proposition. For all these reasons, it's clear we won the debate. We feel the biggest burdens. We're very proud to oppose.
Thank you to Op Reply for that speech. To end this debate overall, I welcome Prop Reply. Here.
Is my voice audible?
Yep.
Okay. Starting my speech in 3, 2, 1. Raise the third speaker self-destructed their own case. If they characterize all developing nations to be that bad to the extent you can't make adequate medicine, then we question why big pharmas are likely to even invest in a messed up country, right? Their side cannot just run away with IMF existing because that's still an exclusive. They fail to prove exclusivity under their side of the house. But two tipping points in this debate within. Firstly, which side can protect the most vulnerable actor of people that need medicine in developing countries? And secondly, on which side can cater towards pharmacies that create medicine anyways, right? So first issue, which side can protect the vulnerable actors of people that need medicines in developing countries. They basically told you, one, medicines under our side of the house will be inaccessible. How do we respond, right? Firstly, we question why their side can be any better, right? Realize accessibility will just proliferate under their side of the house. We characterize patents as only one single company that made this product can produce the product for an amount of years, right? This means no other company can replicate, and this is where other companies are forced to make their own innovations all the time, right? We think that innovation creates more resources being tested and needs more resources anyways until it's successful. This is where inaccessibility will be proliferated under their side of the house, the moment you need more resources anyways. But even if this is likely, all of their benefits are contingent on IMF and international help, which are literally inexclusive, by the way, but we offered a marginal benefit that tips over this claim with the ability to produce the pharmaceutical products inside the developing country, making it way more accessible and cheaper at the end. But second thing they concern to you, firstly, on how medicines under our side of the house will be bad, which is their biggest concern that we tackled, right? How do you respond under here? Firstly, we told you how adequacy of the product, which is the bare minimum, benefits can still be achieved anyways. We played a moderate case scenario where developing countries can't make perfect medicines, and we took the trade-off. Even if you can take this, if they don't want their medication to be bare minimum, they just undercut their benefits, because it means that they're going to have 100 tests to make it perfect, but that 100 tests is going to take huge funds, right? Where now they would still want so much checks and balances under their side anyways. The weighing that you should take judges under government. We told you that it takes a long time in small companies, at least there is a guaranteed chance on succeeding. Under opposition, the accessibility of that perfect medication that they champion is not guaranteed at all, because their benefit is contingent on the interest of big pharmas that they need to cater to all the time. But thirdly, they talk about how national help or IMF will only happen under their side of the house, but under our side, there's no incentive. How do they respond, right? Firstly, when their whip set international relation from China still exists, making distribution feasible, we think that it's already too late for the third speaker. You shouldn't even credit this, right? But even if we need to credit this, we never got any likelihood under this claim, right? Even if national communities have the incentive, it's not needed under our side anyways, right? Realize that now they don't need to spend more money on creating new innovations under our side of the house. They need less money in order to run. But even if we do need national help, we think that it's untrue, right? We think that the parameter of getting help from IMF and international countries is when they're still unstable, right? Let's just say, just because we got our standing ground on being capable to create our own medicine, it doesn't mean that we're suddenly going to be stable at anything else, right? There's still so many issues. We still have so much problem as a developing country. We don't get why they would 100% stop on the funding at the end of the day. But lastly, about market segmentation and their benefit. Firstly, let me point out that this is too late for third to bring, right? But moreover, even if you need to credit this, then they just shot themselves on the leg, because they never claim on how much too much competition actually brings more problem, and this is a harm they put under our side of the house, right? The only side that can bring benefit of market segmentation is our side of the house, where firstly, the moment there's no patent, they're free to replicate these kinds of products. This is true market segmentation, right? Where the product is still the same at the end of the day, we create more effective products under our side of the house, and that's why we win the first tipping point. But second tipping point then, which side can cater towards the pharmacy that created the medicine? They basically told you it's unjustified for us to not give patent, because this directly means the innovator won't get the money. How do you respond? Firstly, unimportant. We're talking about lots of people dying to the expense of just one individual in this pharmacy that get less money. I think it's better to take the trade-off of not this many people dying. But even if we need to defend this, insignificant, right? We characterize companies that can innovate as big pharma in developed countries. They will already have enough income anyways, and they can still put patent in these kinds of developed countries. We don't see the problem, and that's why we're so proud to propose. Thank you.
Thank you to the prop reply for that speech. Thank you to both teams for an excellent quarterfinal round. I think the live stream will be stopped soon. You can cross floors virtually and